Hello, welcome and kumusta, and thank you for joining me. My name is Hao. I am your occupational therapist, and this is Occupational Therapy Conversation. Now, in this session, we'll have a discussion about the basic ranges or the basic values of the range of motion. Range of motion is the movement of the joint in an arc. And I feel it is really important that as clinician, we need to know the values of this. And the problem is, I think you'll have to spend some time to go and look at the book, and you need to memorize these things. And I think this is just one of my efforts to help out so that you know the range of motion, the values of them. Now, the joint ranges there shouldn't be any changes in the joint range, since we're human from a very long time ago and up to now. So you can look at some of the texts that are out there. I don't think there's been a lot of change. So any text that has come from the period of 1960s, 1950s, 2000, I don't think there's going to be some significant changes on the values of the human body's joint range. Now, this one I've taken from the American Academy of Orthopedic Surgeons. So this was the reference for that. Okay, so what we'll do is we'll talk about different parts of the body, and then we'll talk about the values of the joint range. And if there are some associated movements to it, then I'll let you know as well. Now let's start from the head going down to the trunk, and then the shoulder, elbow, forearm, wrist, and then we'll talk about the thumb, the fingers, the hip, knee, and ankle, and then the foot. Starting with the cervical spine. Now, cervical spine has a few movements in it, and that's available. So you have flexion, you have extension, tilting the head up, and you have bending the head sideways, and that is called lateral flexion. And you also have rotation, which is actually turning of the head. So the cervical flexion is from 0 degrees from its neutral, and then it's from 0 to 45 degrees. So that is the ability. So 0 to 45 degrees is a human body's ability to extend the head. Flexion is from a neutral position where the head is upright, and then the person can bend the head down to 45 degrees. So 0 to 45 degrees of flexion, and it has the equal amount of extension, 0 to 45 degrees of extension. Now, when it comes to lateral flexion, it is also 45 degrees as well. Okay. And then when you have rotation, is from the head is in neutral, and if you turn right, and if you find the axis on the head, that is from 0 to 60 degrees, both left and right. Okay, so there you go. It's easy to remember the cervical joints because it's 45 degrees flexion, 45 degrees extension, lateral flexion is 45 degrees, and then you have the rotation that is 0 to 60 degrees. Moving on. Now we'll talk about the thoracic and the lumbar spine. Now, thoracic and lumbar spine is a bit challenging because it's really hard to measure this. And again, just a point of reference. This is with a normal individual, So there are factors that will influence the joint range of the person. If they are young, if they are old, if they have injuries, if they have orthopedic conditions. So there will be some factors that would influence this. What is important for you to know is it is essential for you to know if the joint range has become impaired in a more acute stage. Has it changed? Okay, so when it comes to thoracic and the lumbar spine, it is easier to measure this, I guess, when a person is sitting down or when the person is on side lying. But it's very tricky to do this. From my personal experience, it's hard to do this, but it is useful for those people who are working in seating and in wheelchair services. Thoracic and lumbar spine has a few movement. It also is just like the neck. It also has flexion extension, you have lateral flexion and bending, and you also have twisting and rotation as well. When it comes to flexion, we can bend the lumbar spine much more. So it's 0 to 80 degrees, and then we can extend it from 0 to 30 degrees. Okay, and then when you go and bend lateral, so the range of reference is from 0 to 40 degrees. And then when you are turning the lumbar spine, the range is from 0 to 45 degrees. Okay, so comparing the joint range of the lumbar spine is actually there's more on the flexion as compared to the neck. Okay, so it's 0 to 80 degrees, just to remind you. Extension, it's a less more. So when it comes to the extension, it is less as compared to the extension of the neck. It's 0 to 40 degrees. And then when it comes to rotation, it's also less as compared to the rotation of the neck. And the rotation is 0 to 45 degrees. So that is thoracic and lumbar spine. Now we're going to a more intricate range of motion section of the body, which is the shoulder. With shoulders, there are few movements in the shoulders that are available. So you have shoulder flexion, you have shoulder extension, you have shoulder abduction, and you also have shoulder adduction. Yeah, moving away and moving towards the body. Okay, now the abduction and abduction, that's one. There is another movement that is called horizontal abduction and horizontal adduction. And then you also have, when it comes to the arm, you have internal rotation of the arm. Okay, so we're talking about the arm. This is the humerus. You also have external rotation as well. Okay, so just a summary of the movement of the shoulder. You have flexion, extension, abduction, adduction, horizontal abduction, horizontal adduction, and you have internal rotation and external rotation as well. Now, moving on to the values. So if you raise your arms technically and you're just putting a reference on the arm or the humerus, so this is shoulder flexion, yeah? And the shoulder flexion ranges from 0 to 170 degrees. That's 0 to 170 degrees. But you have to remember that there are associated shoulder girdle movement whenever you move the arms. And some of the associated movements sometimes is when you flex the shoulder, you might notice the abduction of the arm. You might notice some slight elevation, and there might be some lateral tilt. There might be some slightly upward rotation as well. So it's a little bit complicated. These slight movements are the ones that will cause the difference of if it's a minor problem. You can, a person can really feel this. They might compare it from the left and the right hand, or the left side and the right side. Okay, but be mindful of these movements. So you can have abduction, you can have lateral tilt, you can have slight elevation, you can have slight upward rotation as well. Now, when the hand is in neutral, when the arm is in neutral, and you try to extend the shoulder as well, yeah, this is called extension, and the range of extension is from 0 to 60 degrees. Now, you will notice that there might be some associated movement of depression on the shoulder. You can have abduction, and you can have an upward tilt of the scapula as well on this one. So, shoulder girdle movement, yeah. Now, let's go to the abduction. Abduction is 0 to 170 degrees. It is the same as flexion, 0 to 170 degrees. And then adduction, it's 0 degrees. So you shouldn't really be able to adduct the shoulder from neutral. And that is because the body is in the way. If you want to start to adduct, then you might be thinking about the horizontal adduction, because that way you're lifting the shoulder up and then you are moving the shoulder across the midline, and that becomes an internal horizontal adduction. Okay, so with the shoulder abduction and adduction, some of the movement of the shoulder girdle, you will notice an upward rotation of the shoulder girdle. You will notice some elevation, depression, and adduction, and some downward rotation as well of the shoulder girdle. So there will be some shoulder girdle movement when it comes to shoulder abduction. As I was saying earlier on, if you want to do shoulder adduction, you just have to raise the arm to 90 degrees, and you can have some movement there. So shoulder abduction, if you abduct to 90 degrees, and then you actually abduct it even further, then you will notice a movement of 0 to 40 degrees. All right, 0 to 40 degrees of movement when the arm, if you raise the arm with the arm straight and you abduct it, it's like a T position, and then you push the shoulder a bit more, towards the back, then you will achieve a 0, supposed to be a 0 to 40 degrees. Okay, now that's horizontal abduction. Horizontal adduction, on the other hand, this is there will be more range. So again, you move the arm into abduction. It's like in a T position, and you start moving the arm towards the center. So that's 90, and then you can actually move it a little bit further towards crossing the midline, and you can have a joint range of 0 to 130 degrees. In here, you would notice some shoulder girdle movement of abduction and then some tilt. Okay, so that is horizontal abduction and adduction. The shoulder or the arm can actually twist inward. So this is the humeral internal rotation and external rotation. And this is, you can have, in arm in abduction, so internal rotation. So you have many movements. You can move the shoulder or the humerus in various positions. You can move it with the arm in abduction, and it's 0 to 70 degrees. Now, if the arm is in adduction, it is 0 to 60 degrees. So that would be the internal rotation. Yeah, internal rotation of the shoulder, 0 to 70 degrees in abduction, and then 0 to 60 degrees in adduction. Now, when it comes to external rotation, it will be, if you have the arm in abduction, you will have a joint range of 0 to 90 degrees, and then arm in adduction would be 0 to 80 degrees. Okay, right. So these are some of the movements that you would observe, particularly if you are going to the gym and you're working on your therabands, for example. And so again, with the shoulder in abduction, external rotation would be 0 to 90, and with the arm in adduction, 0 to 90 degrees. Yeah, so technically it's 60, 70, 80, 90. So that would be the movement. Okay, now going to the elbow. The elbow has two movements only. Yeah, it's just flexion and extension. Yeah. And the elbow flexion and extension, flexion is 0 to 135 degrees to 150. So you have a range 0 to 135 to 150, depending on the size of the muscle bulk, depending on the size of the muscle as well. Okay, 0 to 135 and to 150. Now extension, if you extend the arm, you cannot hyperextend that anymore. You shouldn't be able to. That's hyperextension, and that's hypermobility if you have noticed an extension from when the arm is straight. So you only have flexion movement, 0 to 135 to 150, and then a return of movement from 135 to 150 down to 0 degrees. Okay. Just to remind you guys, the point of reference here is the anatomical position, okay? So if you're not familiar with the anatomical position, then we may have to discuss that in our future podcast. But it's very simple. Just look it up. Okay. Going now to the forearm. Yeah. Now on the forearm, the movement that you will observe in the forearm are two things. You have the pronation and the supination. With the arm in neutral position, it's 0 degrees, okay, and then you turn it down and you will achieve a 0 to 90, 80 to 90 degrees. An extension would be from 0 degrees as well, and then you turn the palm up, it is also the same, so 0 to 90 degrees. So the shoulder, you will have some tightness and movement in here. You will notice some tightness and movement if you have some form of a tonal issue, particularly with the pronators and the supinators. Yeah. Okay. Next joint will be the wrist joint. Now in the wrist joint, you have a few movement. You have flexion of the wrist, extension of the wrist. You have ulnar deviation, and then the radial deviation as well. So the flexion is 0 to 80 degrees. Extension will be 0 to 70 degrees. So there is lesser extension than in flexion. And then when you're moving to the ulnar deviation, there is more on that. It's 0 to 30 degrees. And when you go on radial deviation, it's 0 to 20 degrees. Now, what is the importance of this? One might you say some of the trivial information, but it's actually important. I wouldn't say it's trivia. There is more joint movement on the ulnar deviation. So when somebody has an arthritis, yeah, that tends to erode a bit more that ulnar side. That's why the tendency of the arm, and because of the pull of the muscles, the tendency is for these muscles to pull more and would damage the joints a bit more. So the tendency of the arm is to position itself in an ulnar position, and that's why you would call it an ulnar drift. Yeah, that is on some information on the wrist. Going more specific, if you go into the hand therapy side of things, but then if you're working in restorative and providing restorative intervention, say in critical care, then you would be working with the thumb, okay? And with the thumb, you have some movements like DIP flexion, you have MP flexion, okay, metacarpophalangeal joint. DIP is the distal interphalangeal joint, okay. You can have abduction, or you can also call it the radial and palmar abduction, okay. So when the thumb is moving away from the palm, yeah, so that is considered as abduction. And you can have palmar adduction, okay. And then you can have a radial, abduction. So that's moving the thumb away, okay, from the body. And then you can have some opposition movement, and that's how you would describe the movement on that. Okay, so the DIP flexion, so distal interphalangeal joints so there's only one IP joint in the thumb. So the DIP would be from 0 to 80 to 90 degrees. And then the MCP or MP, metacarpophalangeal joint, is 0 to 15 degrees or 45 degrees. So that's what happens when so what you'll need to do is you stabilize the metacarpal, yes, and then you can just see that the proximal, so this would be the metacarpophalangeal joint, is very, very limited. The MP flexion of the thumb is 0 to 50 degrees, okay, metacarpophalangeal joint. Now, when it comes to abduction and radial and palmar abduction, okay, so adduction should be 0. Again, you can't push it towards the palm anymore, but you can have palmar abduction, which is moving away from the palm, 0 to 50 degrees, and then the radial abduction is 0 to 50 degrees. How would you remember this? Is you think about the magic number in the thumb is 50 degrees, yeah? So you can have, apart from the DIP flexion, which is 0 to 80 to 90, but you can have MP flexion of 0 to 50 degrees. And then palmar abduction 0 to 50. Most of the movement on the thumb is 0 to 50 degrees. That's the thumb. Now let's go to the fingers. With the fingers, you have MP flexion, that's metacarpophalangeal flexion. Yeah. And the movement, this would be the proximals, is from the knuckles, really. It's 0 to 90 degrees. And then from the knuckle joint, or MP, you can have an extension, and you would notice an extension that ranges from 0 to 15 degrees all the way to 45 degrees, which is hyper extension of the fingers. It depends, and it varies from person to person. Now the PIP, the proximal interphalangeal joint, that is 0 to 110, so it's very bendy. So if you look at it, yeah, it's more than 90, it's around 110. The DIP flexion is from 0 to 80 degrees. And then, if you think about it, you can spread your hand and you will see that the fingers abduct, and that abduction ranges from 0 to 25 degrees. Okay, so it's always 0 to 25 degrees. All right. Okay, what have we learned from the fingers? The IP joint, that's 110. Okay, there's a lot of movement there. We have realized that from the knuckle joint, you have an extension of 15 to 45. The knuckle joint can bend all the way to 90 degrees. Actually, mine is a little bit more, so I've got a hyper flexible MP flexion of my fingers. So those are the complicated joints of the hands, all right? So you have the wrist, you have the thumb, you have the IP, or the fingers. Now we're going to the bigger joints, which is easier to move if they are in supine position. And so it's the joint of the hip. It's femoroacetabular, or just the hip joint. Here we go. So the hip joint, it has a movement of flexion, extension. You can have abduction, adduction, and you can have internal and external rotation on the hip joint. Yeah, all movements. Okay, right. A flexion of the hip is from 0 to 120. Okay, and that is actually with the knees bent. All right, because you will have an influence of the insufficiency or the tightness of the hamstrings if you bend the hip with the knee straight. That can be painful, but with the knees bent, it's 0 to 120 degrees. Now the hip extension is from 0 to 30 degrees. All right, 0 to 30 degrees, with exemption to those people who are very hyper flexible, the ballerinas, you know, the street dancers, occupational influences. All right, and some genetic influences too. Right, so you have an extension of 0 to 30 degrees. The abduction is 0 to 40 degrees. Yeah, all right, 0 to 40 degrees. And then the adduction is from neutral. You can adduct the hip to 0 to 35 degrees. Now, both internal and external rotation is just like the movement of the spine, so you can have these reference. They are 45 degrees, both internal rotation of the hip and the external rotation of the hip. Now the knee flexion is from 0 to 135 degrees, and that's with the knee straight, and then you bend the knee backward, so the range is from 0 to 135. Then the extension of the knee is from 135 back to 0 degrees as well. Okay, so that's the knee flexion. Now we're going back to the ankle and foot, right? So ankle and foot. So there's 4 movements in the ankle, you know. So you have the plantar flexion, where the toe is pointing down. You have dorsiflexion, where the toes are pointing up. You have inversion, and you have eversion. So the plantar flexion, just like the ballerina, is supposed to be like 0 to 50 degrees. But wow, the ballerinas have got the point. It's almost like straight, isn't it? But 0 to 50 degrees is the normal range for plantar flexion. The dorsiflexion is just a slight, very slight movement only. It's 0 to 15 degrees is the joint range. The inversion is 0 to 35 degrees, while the eversion is 0 to 20 degrees. So implications of inversion and inversion, just like the ulnar deviation and the radial deviation, isn't it? There is one more on the other, and there is more tendency for the leg to invert, which has a range of 0 to 35 degrees. That's why that is the movement that is common when you strain or you have an ankle sprain. All right, the anterior talofibular ligament, I believe, if I'm not mistaken. All right, guys, so those are some of the joint ranges. I hope you learned a little something. I thought this is going to be a straightforward, very short discussion, but in fact, it's approaching 30 minutes. Okay, so in summary, what have we learned today? There are joint ranges that is out there. It is really tricky to remember them all, but as therapists and as clinician, we should remember them because it is part of a job. And also, the joint range is a performance component. So you can have some interventions on the joint range, and when you move it, this is called a restorative intervention. If you listen to my previous podcast, the treatment is a biomechanical approach where you're doing some passive stretchings as well. And then the joint range problems can have an influence because of the swelling. You can have tightness, you can have contractures, you can have muscular influences, you can have edema as well. So that's why it is important to know that, because if you are measuring for outcome, the outcome is all about these joint ranges. That's how important this is. So don't think less of it. It is important because the outcome measure for this are these numbers. So for example, if you start saying, the arm is, passive range is only like 0 to 45 degrees because of adhesive capsulitis or because of a shoulder hand syndrome, and it's limited because of the pain. So once that pain subsides, the next thing that you'll need to do is you'll need to do that active and passive stretching, and then you will measure the improvement based on the joint range. And if you remember, what is the joint range for shoulder? What is the normal joint range? 0 to 170 degrees for shoulder flexion. All right, it's exciting, guys. Right, I hope you learned a little something today. Just pass this information to your friends and learn together, grow together, right? Just remember, anything you do matters and has an outcome. Until next time, bye.